Hello, I'm Dr. Neil Renaud, and I'm a developmental optometrist. Today's video is all about developmental optometry, what that means, and what kind of things I do on a daily basis. And before we get started, make sure to hit subscribe, follow us on Facebook and Instagram, and let's get going. A developmental optometrist focuses on developmental and behavioral vision care, vision therapy, and neurooptometric vision rehabilitation. So I am an optometrist. I'm an eye doctor, a little different than an ophthalmologist who's more of a surgeon. And optometrists, there's different types of optometrists as well. We may be in primary care, we may prescribe glasses and contacts. Some eye doctors, they focus more on disease and specialty contact lenses, low vision, things like that. There's different specialties. My specialty is in developmental and rehabilitative vision care, along with vision therapy. I start with a functional vision assessment that goes way beyond just clarity and acuity, way beyond 20/20 vision. That's one of about 30 or so visual skills we address and assess, in addition to your prescription and your eye health. So generally, I'm looking at a patient's ability to acquire, process, and effectively and efficiently use that information for whatever task they're functioning with, whether it's reading, sports, mobility, everything in life that we need to see with our eyes open. I'm looking at how they are able to function with their eyes and lead their body through space. Some other things I look for are like tracking or pursuit eye movements. Can they follow a moving ball? Can a patient make quick scanning movements? Like for instance, reading, we're scanning word to word to word across the page. Or maybe this patient is someone who frequently loses their place. They reread things a lot. Their eyes kind of bounce all over the page because they don't have great visual coordination. Plus, can your eyes work together on the same team, especially up close where we spend most of our day? Can you point your eyes so that you see single and clear vision? Can you see in 3D? Can you be aware of all of your peripheral vision around you in 3 dimensions as well? And we assess visual perception, which is how we really process the information that our eyes send our brain to do things like visual memory or visual analysis, visual attention, reaction time, processing speed, and visual sensory integration like handwriting or catching a ball with our hand. And this is a lot different than your very quick eye exam. Sometimes this can take me as short as 1 hour all the way up to 3 hours of testing to get a really thorough understanding of how someone uses their eyes, along with a lot of patient education and communicating with parents as well. So how do you become a developmental optometrist? How do you choose that career path? I'll tell you my story. I started off by shadowing my optometrist and finding out about his practice that had vision therapy and just fell in love with it. And went on to optometry school where you learn about everything about vision and about eyes. So every optometrist has taken a vision therapy course on eye turns and lazy eyes, things like that. In addition to diseases, glaucoma, contact lenses, you learn about everything. Then if you want to specialize after optometry school, I did a 1-year residency in vision therapy and vision rehabilitation, where I spent 1 year every single day really mastering this craft, learning under the best tutelage, and spending a lot of time with education as well as patient care. Then there's a lot of continuing education as well. I learned from the College of Optometrists and Vision Development, the Optometric Extension Program, the Neuro-Optometric Rehabilitation Association, and there's others as well. So there's so many ways that you can continue learning after optometry school. And then we're never really done learning. There's so much research out there we have access to, and we can contribute to our field and really stay up to date with the latest and greatest ways to test and treat our patients. So that's how I got here. And now who do I work with? Starting off right from the beginning, we are actually born legally blind with very efficient and almost useless eyeballs. We can't see much of anything. Then we slowly learn and develop how to see. We learn how to see 20/20. We learn how to see in 3 dimensions. We learn how to move our eyes accurately back and forth or track a moving ball. So we slowly go from useless eyeballs to very functional eyeballs that lead our body and our thinking and thought through decision making and through analysis. And for some people, those visual skills may not develop appropriately. We may develop asymmetrically or behind. And our services got even more essential around 100 years ago when everyone had to go to school, everyone had to learn how to read, and we had to use our eyes in a way that we never really on a large scale had before. So I wanted to focus on this specialty of vision care because there are just so many people that we can help, and they're all so unique and special. Every case is a little bit different. And for me, my very first patient that really got me interested in vision therapy was way back when I was shadowing my optometrist, and there was one particular patient who always stuck out to me. He was in 4th grade at the time, and way behind in reading, very frustrated with school, constant arguments during homework, not confident in himself. And to see him travel through vision therapy and grow and develop his vision, which helped him read better, helped him feel more confident in himself, helped him get less frustrated because he was more successful. He was a different person. He was not just different eyeballs, but a different person because of vision therapy. And that really intrigued me to see how many more types of patients we can help with having their vision lead instead of impede their life. And vision can really help or interfere with our stress and behavior as well. For example, someone with tunnel vision who's not aware of their periphery, that can sometimes lead to a lot of stress and anxiety. Someone who gets headaches and eye strain every time they read, well, they may start avoiding reading and show signs of poor attention. And someone who is not confident in the efficiency and accuracy of the information their eyes send their brain often can be not very confident in themselves as well. And then even if you have these visual skills developed properly, you may suffer a brain injury like a concussion, a stroke, a neurological disease that causes you to regress where new visual problems arise that never really were present before. And good vision can even be enhanced as well. For example, an athlete may want to have faster visual processing speed or finer visual acuity and depth perception or even better hand-eye coordination and many more. So I get to help people solve problems and improve their quality of life. In vision therapy, we work with patients for a certain amount of sessions, a certain amount of time frame, where we improve the visual skills that I find deficient, and then over time track their progress as we build these skills and monitor improvements in their test scores and in their real life abilities. We also prescribe therapeutic lenses that may improve really quickly and rapidly their visual symptoms in their real life right away. Like if they have eye strain while reading or motion sickness or difficulty balancing, we can fix those problems quickly with a pair of glasses, different from just regular glasses that help you see better, but help you function better. For many people, a routine eye exam works perfectly fine. But if you're one of those people who has a nagging visual issue and you've seen lots of eye care providers over the years and it hasn't gotten better, no one's been able to quite figure it out yet. Or you're a parent with a child who isn't quite working up to their full potential and you want to see is there something missing? Could it be something wrong with their eyes and how their eyes are working? Even if they see 20/20. Or you have really any difficulty functioning or any ability that you suspect is related to your eyes, trust your gut. Patients are often really right about this, that their eyes are playing a role. It just hasn't really been diagnosed or found yet. So this may be right for you. You can find a local developmental or rehabilitative optometrist at covd.org. Click on Locate a Doctor and you can find someone nearby who has a lot of training and expertise in this area of optometry. And if you're interested in this field, go out and find someone at covd.org that you can shadow and go learn more about this field. See if it's something you are interested in. So this area of optometry is rapidly growing. We're trying to make vision therapy more accessible to everyone who needs it. So I'm hopeful that this video may help you find the services or the career inspiration that you're looking for. Thank you so much for watching.